Thank you, Toastmaster of the Day, fellow Toastmasters, and honored guests. The title of my speech today is My Patients Say the Silliest Things, Part 2. This speech is a continuation of a speech I did a few months ago, where I talked about some of the encounters I've had with some of my patients over the years and some of the valuable lessons I've learned about these encounters. The first encounter I'm going to talk about occurred when I was working in the emergency room. And this encounter occurred on a Saturday night. Saturday nights in emergency rooms across the country are the busiest nights of the week. We see all kinds of people and situations on Saturday nights. We see things like the women who come in labor about to give birth who claim they didn't know they were pregnant for the last 9 months. That's really a thing.
Wow.
We see things like the people who have come in and stuck things up their butt and can't get them out.
Wow.
The case I saw on the x-ray, there was a screwdriver up there. Our Toastmaster meetings meet on Thursday nights, but on Saturday nights, you see frequent meetings of the Gun and Knife Club. They frequently have their meetings on Saturday night. And of course, on Saturday nights, we see the most colorful people of all, who are the alcoholics and drug addicts. For some reason, they have their meetings on Saturday nights. On this particular Saturday night, I was called to see an alcoholic man, a Caucasian fellow. And this man was not only drunk, but he was angry drunk. He was yelling and screaming. He was cursing. He was trying to punch and kick the nurses. He was so wild that the nurses had to tie his hands and feet to the stretcher. The nurses come up to me and say, Dr. Dubin, we need you to get some blood from this patient. Oh, great, just what I needed. I go into the room and the guy looks at me and says, Who the F are you? So I walk in, I say, Hello, sir, I'm Dr. Dubin. I'm going to be your doctor today, and I'm going to need to get some blood from you. So I go at him to get some blood, and he says, Get away from me, you effing monkey. Whoa. I have never been cursed at in such a racist manner before. So I'm just furious with this guy. I'm seeing red. I yell and scream back at him. I say, Wait a minute. You're tied up like an animal and you're calling me a monkey? That really set him off. He started yelling and screaming, trying to punch and kick and curse. I realized I wasn't going to get any blood from him now. So I left the room and I went to talk to the chief of the emergency room. I said, Hey, chief, this patient here, he's a racist. He called me a monkey. I can't take care of him. You're gonna have to get someone else to take care of him. And she says, No, Dr. Dubin, you're on call. He's drunk. He's going to say a lot of crazy things. You can't let that bother you. You got to go back in there and take care of him. Great. Not what I wanted to hear, but he was right. I waited about a half hour and I went back in. He was a lot calmer. And he said, Oh, hey, doc, I'm sorry I called you a monkey earlier. And I said, Okay, that's fine. I accept your apology, but I still have to get some blood out of you. And he says, Okay, but if I let you take the blood, will you untie me from the stretcher? And I say, We'll see. So I go and take the blood. I start to walk out the room. He says, Hey, wait a minute. Aren't you gonna untie me now? I look around. I say, Well, sir, I'm about to go off my shift. So I'm gonna let the next doctor untie you. So I continue to walk out and he says, F you, you MF. My patients say the silliest things. A few years later, I was working in the hospital and I was called to see another patient who I was told was being very disagreeable. He was refusing all the tests and medications that the staff was offering him. I look in his chart. I see that he's having some problems with his kidneys. I go in the room. I say, Hello, sir. I'm Dr. Dubin. I see you're having some problems with your kidneys. We're going to have to do some tests to figure out what's going on with your kidneys. And he says, I don't want any tests. I say, well, it's very important we do these tests because we may be able to give you some medication that can help your kidneys. And he says, I don't want any medications. I said, look, it's very important that we do the tests and give you medications because if your kidneys keep getting worse, you might need dialysis. And he says, guess what? I don't want any dialysis. So I said, okay, well, what do you want? And he says, what are you asking me for? You're the doctor. If you were to look in the dictionary for the word pervicacity, there would be a picture of this guy. This guy was so stubborn. So I walk out the room, sign off the case. A week later, they call me back because now the guy's having chest pain and I'm the cardiologist on call. So I walk in the room, I say, hello, sir. It's me again, Dr. Dube, and I hear that you're having chest pain. He says, yes, I'm having chest pain. I said, okay, well, we're going to have to do a stress test to figure out if the pain is coming from your heart. He says, I don't want a stress test. I say, okay, well, if it is your heart, you could have a heart attack and we would have to do a catheterization to open your artery with a balloon. He says, of course, I don't want a balloon. So I say, okay, what do you want? He says, what are you asking me for? You're the doctor. After a few more days of this, the hospital has finally had enough and they call security to escort him out the building. My patients say the silliest things. And finally, a few years after that, I was seeing a patient in my office. And this guy had very difficult high blood pressure. I had a hard time controlling his blood pressure. I was trying different medications. I was having him come back every week. Nothing was working. A few weeks went by and he didn't show up for his appointment. He finally showed up 2 months later. And I walk in the room, I say, hi, sir, I haven't seen you in a while. How have you been? And he says, you haven't seen me in a while because I was in a hospital because I had a heart attack. I said, oh, I'm sorry to hear that. He says, yes. And I had a heart attack because you couldn't control my blood pressure. So I look at the guy. I see this big pack of cigarettes in his pocket. I say, ah, I see. You've been smoking cigarettes. Cigarette smoke has carbon monoxide that makes your arteries very stiff. That makes your blood pressure go up. Also, cigarettes have nicotine that make your arteries go into spasm and cause heart attacks and strokes. Therefore, the reason you had a heart attack is because you've been smoking cigarettes. It then says, no, Dr. Dubin, I've been smoking cigarettes all my life. I didn't have a heart attack because of cigarettes. I had a heart attack because you couldn't control my blood pressure, and I'm going to sue you. I say, okay, sir, you have a good day. I leave the room. He leaves. I go to my office manager. I say, hey, this guy's trouble. We're going to have to fire him from the practice. So the process of discharging a patient from medical practice requires that you send them a letter saying they are no longer welcome in the practice, and you have to give them a list of other doctors to go to. So we sent out the letter. As far as I know, that's the end of that guy. A month later, he shows up again for an appointment. So I go to my office manager and said, hey, what happened? Didn't we send him the letter? And she says, I sent him the letter, but maybe he didn't get it. So I'll give it to him in the waiting room. She goes out to the waiting room to give him the letter. A few minutes later, she comes back. I say, what happened when you gave him the letter? She says, he opened the letter, he read it, he crumpled it up, and said, fine. I didn't like that little bastard anyway. I said, what? He said, what? He said, I didn't like that little bastard anyway. And then I say, how dare that guy call me little? My patients say the silliest things. In summary, what valuable lessons can we learn from these stories of my patients saying silly things? First of all, if someone yells and screams at you with anger, don't respond in kind. Don't fight fire with fire. If you fight fire with fire, all you're going to get is more fire. Instead, fight fire with water. Or just leave the problem for someone else to deal with. Better idea. Secondly, if someone is being disagreeable and not accepting any of the solutions you're offering to their problems, don't waste your time and breath with these people. Call security or the police to escort them out the building. And finally, if someone threatens you and calls you a terrible name, remember, sticks and stones may break your bones, but words will never hurt you. Unless you say the words, I've been smoking cigarettes all my life. Thank you, Toastmaster of the Day, fellow Toastmasters, and honored guests.
Thank you.